Hi, I'm Kerry Holden and I'm the Deputy Director for Infection Prevention Control here at Gloucestershire Hospital's NHS Foundation Trust. And this week is International Infection Prevention and Control Week, which is a fab time to remind ourselves how important it is that we can all play our part to prevent infections. And this year we're standing up for IP Week, which means we want to unite, protect, prevail and make sure we're preventing infections together. And we can all play our part. So some really key things and tips that we can all do to prevent infections. And the most important, or one of the most important, is keep these things clean. Make sure we wash our hands. It's really important to wash your hands when we've been to the toilet and when preparing and cooking food and before we eat. And that can minimise the transmission of infections, particularly things like norovirus that are spread via fecal oral transmission route. So one of the things we can all do to keep ourselves safe from infections is to prevent them in the first place. So we can all take up the opportunity to have vaccines that are on offer to us. So this year, I'm definitely going to have my flu vaccine as a healthcare professional to protect my patients, myself and my loved ones at home. And I encourage you to do the same. So we know it's a time of year that winter viruses will be around. We know things like influenza and COVID and even the common cold is about and can affect us all quite significantly. So it's really important if you're coughing and sneezing that you do so into either the cuff of your arm or you do it into tissues, and make sure that you discard those immediately and make sure you wash your hands afterwards. If you're coming into hospital to see a loved one or you're going into a care home or a residential area, it's really important that if you are experiencing any of those symptoms of diarrhoea, vomiting or any kind of coughs or colds, we encourage you to stay away. It's really important we protect the most vulnerable people in society, and sometimes keeping away from them is the best thing to do. So we know every year norovirus likes to rear its ugly head, and that's a bug that often causes diarrhoea and vomiting, can affect people in the community and also in hospital. So when you are having symptoms of diarrhoea and vomiting, do stay away from hospitals, don't come in, and make sure you stay away for at least 48 hours until you've had no symptoms of diarrhoea or vomiting. And when you're coming into hospital, it's really important to use soap and water, as we know alcohol sanitizer isn't effective against diarrhoea and vomiting bugs such as norovirus.